Reports from the Ministry of Health show that nearly 30% of all hospital admissions are linked to the sickle cell disease, and between 6,000 to 9,000 babies die of the condition every year. But what does having sickle cells really mean?
Sickle cell is an inherited disorder of our red blood cells. Normally, for a person to have normal red blood cells, they are supposed to be round such that they can pass through the blood vessels very well. But for sickle cell, they attain a sickle cell shape whereby it's very hard for them to pass through the blood vessels, hindering blood to reach to the various parts of the body.
Unfortunately for many, this crisis comes without a choice.
A child gets a gene from both parents. So you can get a sickle cell trait from your mother or your father.
However, not everyone who carries the gene gets the disease.
Sickle cell patients, then we have sickle cell traits. By someone having a trait, it means got that abnormal trait from one of the parents. That is HBS1. But for someone to have the disease itself, they have to have that sickle cell gene, like two of them, meaning they got it from the mother and the father. That is when you have the sickle cell disease.
Anemia is just but one symptom of this disease.
You have less blood in your body. Some have complicated joint pains. Usually they can feel fatigued every time they are feeling tired. Most people can also have yellow eyes. Some of it, we call it jaundice. The other time we have swelling of the hands, the face.
With 25% chances of each pregnancy ending up being a sickle cell child for 2 careers, the founder of Blood Run for Infirmities, Ronnin, believes significantly testing before having children makes the difference.
Because the fight against sickle cell anemia must begin with knowledge. This silent killer can hide in families and be passed on to children unknowingly. I urge the young people out there to test for the sickle cell trait before having children. Prevention is much more cheaper than managing a disease or treating it.
But for someone who has a trait meaning you have only one gene of sickle cell, that one does not have symptoms, but they can easily carry the disease to their kids, because in case they get a partner that has the same gene, there is a high possibility in all kids they will produce, there will be at least one who will have all those double genes, that is the SS, the sickle cell trait.
Activists like Rising Warriors are taking a step in awareness campaigns through public screening.
Kutest kunkebela sickle cell nenzula nga me carrier. So mulimu nganze sitidde ne kati kyenina okulwanyisa okulaba nga sifuna mukazi naye nga ali carrier.
They are also set to have a sports gala to still increase awareness.
On 27th of June next month, we're going to be at Lugogo hockey ground. We're using the sport, we're using our talent to bring awareness.
But with regions like Lango and Busoga continuing to record very high numbers, the country could use more effort, especially in screening and awareness, if Uganda is to reduce the sickle cell's burden. Pauline Ongoet, UBC News.